let's get started. I know, Will, you mentioned that you've probably been using it the longest. So how long have you, can you tell us about your journey with DoseMe? Have you been using it all patient population? Just a little bit about your
Yeah,
experience.
absolutely. We started circa 2015. I was looking for tools to help implement the changes I knew that were coming down the pike from the change to AUC-based dosing and monitoring. And I knew we were going to need some IT support for that, and started surveying available options, and landed on this website called DoseMe and filled out a email here for more info. And we've been working with DoseMe ever since. So we use DoseMe in all of our populations here. We don't really do pediatrics at the Central Referral Hospital where I work, but I know our community hospitals do use it in pediatrics as well. About the only population that right now we kind of exclude from DoseMe's use is our neurocritical care patients. And there's just some very kind of entrenched ideas about dosing antibiotics and bank and those kind of neuroinfection cases. But other than that, everybody's pretty much a candidate at Houston Methodist.
Great. Becca, I'd love to hear your experience. You've been using it for about a year now.
Yeah, about a year. And it really was very well accepted, especially by nephrology when we showed them all the data. So we went live. We've been using it in pediatrics. We do have a NICU pediatric program, so they both do use DoseMe there. We've been using it in adults, and like you said, we do exclude neuroinfections. But otherwise, it's pretty much most of our patients.
Great. And last but not least, Julie?
Yeah, so we actually just recently implemented DoseMe this past spring, and we actually took kind of a phased approach because we were actually going to transition to dosing all vancomycin, which was not our previous practice. So we've actually, just as of a couple weeks ago, we are now dosing all vancomycin for our patients. And we primarily see an adult patient population. We do get a few peds, but we have a peds hospital down the street. So pretty much we focus on those adult patients.
Great. So it sounds like DoseMe helped you implement that new protocol, so to speak, or new service, taking over, all of the vancomycin patients. So, and with Becca, you mentioned pediatrics. So was that something that was doable because of DoseMe platform being available, or how did that come about?
Yeah, so we've been dosing all of our adults for quite some time, historically trough-based dosing, and then switching to AUC with DoseMe, but that was all pretty smooth. What changed was in pediatrics, we had previously, we'd given recommendations on vancomycin dosing changes, but really we hadn't taken it on as the pharmacist dosing it. And when they heard that we could do AUC dosing, the pediatricians were just on board. They wanted us, they had seen the data, they wanted to do it, but didn't have a way to do it. So as soon as that came live in pediatrics, they're all ours. So we've been doing most to all of our pediatric vancomycin dosing since DoseMe. So that was a huge change for us, really good change for us.
Awesome. And Will, is there any new protocols or anything that DoseMe was able to help you implement? I know you've been using it for some time now.
Our protocols really haven't changed. We've had a pharmacy vancomycin dosing protocol at all of our hospitals in various different forms for a long time, as long as I've been with the organization, which is about 18 years now. It has expanded. We have worked on unifying those protocols, but really the push to a tool like DoseMe was to allow the conversion of targets and AUC targeted dosing, as opposed to historical kind of trough-based methodologies. And the other thing it facilitates is, there's multiple ways to do AUC dosing, but if you want to keep it at kind of a low level burden, then you need IT support for that.
Yeah, that sounds like a lot of what I hear from other institutions as well. So, as a company, we really look for feedback from our customers, people who are using it day in and day out. Can you elaborate on a feature that maybe your team was able to request from us and now have seen it come live and how they utilized it?
Yeah, we one of the things that originally when it came out, well, not when it came out, I was not there. When we got it, was the intervals. We kind of put in what our normal standard interval was, and that was Q12 for us. And so every patient, when it started recommending doses, they always came up as Q12. And one of the recent updates, they changed it to really be more patient specific and take into account the patient's clearance and the patient's half-life. And so now it's more specific to the patient. So we actually had pharmacists using that Q12 like, oh, it's recommending this. And so it's really helped us that the platform was able to make that adjustment and change the way we see it initially when we go in.
Yeah, I think you're referring to the intuitive interval. I know that was something that we receive requests for that quite often, and it was a matter of time. So I'm glad that's helpful from your standpoint. And Will, I know you've seen the platform go through a lot of changes, so I'd love to hear what feature that you saw and had requested.
Yeah, we've used DoseMe in a number of fashions. We started with kind of standalone, non-integrated, cloud-based, enter all your own data. And then we went to a kind of third-party integration through a clinical decision support software, which is what we use now. But then there are some delays, as with any IT interface. And so, sometimes things will get miskeyed in the EMR and then go through and, kind of fudge up the data in the system, and the ability to actually go in and edit the data inside the DoseMe platform, change a time so it's not at the same time as a level because you talked to the nurse and you knew the dose was not actually given after the level was drawn, it was right before. So to be able to troubleshoot those things kind of in the moment was a really big change for us in terms of efficiency and user satisfaction.
Great. So I know we've made a lot of changes and a lot of features. How would you say, Becca, that it's improved maybe your workflow or your team's workflow based on what you've heard from your team?
Sure, and this goes back to that editing data thing. We requested that also, that we have a lot of issues with transitions of care because we take patients from all these little tiny small hospitals around Montana, and so they've gotten 1 or 2 doses of vancomycin prior to coming to us. So using that edit, you can add in those previous doses and get your calculator to use those for your calculations. So that's really helped with our transitions of care to inpatient, but also facilitated then going back outpatient. Should you be on long-term vancomycin, they can continue to use the platform and add in doses onto the account as an outpatient and use the dosing outpatient as well. So it's really helped us with transitions of care, and I think that that's been a great change for our patients.
That's great to hear, because I know that one of the nice features is that notes and communication tool within DoseMe, which helps kind of talk through, from handoff perspective from one pharmacist to another. So it's really nice to hear that you're able to utilize that. And Julie, would you say there's been any improvements in workflow or anything that's helped from the new features?
Yes, actually the progress notes have helped us with standardizing our documentation, and it's so much easier than our previous method for leaving progress notes within the chart that we're much more efficient. And I think one of the great recent updates that's been super helpful is within the clinical notes. So that information that we customize within the progress notes pulls into the notes and activities log. And so we found that really helpful and gained some additional efficiencies from that.
And so I know that your institution recently implemented, so this spring is when it started, and now recently you've taken over all of vancomycin dosing. What would you say is sort of the most impactful feature in helping you accomplish that goal as it relates to DoseMe?
Yeah, so I think one of the things that made this easy to do, if you will, was the EHR integration. When I first started looking at this product, I was able to use the web-based version and really liked that. But with our volumes of vancomycin and just the amount of work that we do each day with managing and monitoring, we would not have been able to survive on the web-based, to be quite honest. And so the EHR integration was key in our transition from trough-based monitoring to AUC-based monitoring. So.
And Will, what about you? What do you think's been most impactful for your institution?
Yeah, I'll absolutely second that to a large degree. We used the web-based version, enter all your own data points, enter all your own doses. And there were a lot of improvements made over the years that we were using that platform in, ease of use for entering data points, but nothing compares to the efficiency of data just flying in from either your EMR or a clinical decision support tool kind of embedded format that we use. So that's been a huge time savings, a huge boost in efficiency, and a huge boost in end user satisfaction for the platform.
Yeah, I mean, as pharmacists, we love integration, right? Anything that can automatically be populated to make our lives easier, since we're toggling between so many different programs and addressing so many different aspects of patient care. So it's good to hear that was a move that your institution's made and something that was very beneficial.